Hi, my name is Erin Bertoli, and I'm a Board Certified Behavior Analyst with Brett DiNovi Associates. And in this video, I will be talking about Greg Hanley's work on practical functional assessment of problem behavior. If you're a BCBA who struggles at all with traditional functional analyses, then this video is for you. Going almost 10 years as a behavior analyst, I've spent a lot of time conducting FBAs. And in doing so, I have relied a lot on ABC data and indirect interviews and rating scales that did not end up matching the results of my functional analyses. Or when I run the standard FA, I either do not see any maladaptive behaviors, or on the contrary, I observe problem behavior during multiple conditions, including on the breaks in between sessions. This could be related to the fact that we're contriving situations. We're breaking apart naturalistic relations and conditions and looking at things through a very particular lens. This functional assessment procedure that I'm sharing with you today relies on open-ended interviewing and a subsequent synthesized functional analysis. This process is referred to as an interview-informed synthesized contingency analysis, or the IISCA. Functional analyses should never be a one-size-fits-all approach. The IISCA begins with an interview. According to Dr. Hanley, the intention of the interview is to reveal sensitivity of classes of problem behavior to ecologically relevant reinforcement contingencies. A successful IISCA serves as an effective baseline context to treat problem behavior and to develop important social repertoires.
As you can see on the interview form, many questions are asked to get as much information as possible on any and all possible motivators and evocative effects.
Once the interview is complete, you can design and plan for your synthesized contingency analysis. The following form will guide you in this process. You're going to describe the problem behaviors and their precursors and behavioral indicators. You will describe the synthesized establishing operation. You will describe the reinforcers to be synthesized, and then you will describe your IISCA. You're going to start by designing the test condition to emulate the most challenging context derived from the interview, and then design the control condition. The only difference between the two is the presence, the test, or the absence, the control, of the synthesized reinforcement contingency. And then you're ready to start your synthesized contingency analysis. Always start with your control condition. Have your materials readily available and provide suspected reinforcers non-contingently and continuously. This is the life is good condition. Zero problem behavior should occur here. You will then go to your test condition. You're going to provide synthesized reinforcers for about 30 seconds immediately following problem behavior. The individual should have access to the reinforcement for 20 to 40 seconds. Sessions should last 3 to 5 minutes in duration, and you will simply alternate between your test and your control conditions. Terminate your analysis when sufficient control is achieved. For example, you have reliable zero or near zero rates in your control and elevated but controlled rates in your test conditions. You'll record your data on a form similar to this. And that is it. 2 conditions. Many would argue, but this goes against everything we've been taught regarding functional analysis. Or you're doing the exact opposite of teasing out the controlling variables. You're really not coming up with the primary function.
And in fact, there have been a number of studies that have attempted to prove these challenges against the IISCA. In this study, published in JABA, Dr. Wayne Fisher and colleagues found that the IISCA did not produce stronger experimental control than a traditional functional analysis. Their findings were derived from within-subject comparisons of the two approaches.
Dr. Hanley would argue, isolated contingencies don't always control behavior the way that synthesized contingencies do. So in terms of individuals with disabilities, oftentimes it's the combination of synthesized contingencies that turn off and turn on behavior. For instance, escaping demands to access toys, or accessing toys with attention, or escaping to engage in stereotypy, automatic reinforcement with toys, or escaping to access rituals. According to B.F. Skinner, a common source of misunderstanding is the neglect of what happens when variables are combined in different ways. Although a functional analysis begins with relatively isolated relations, an important part of its task is to show how its variables interact. All we really need to know are the specific reinforcers, mainly the combination of those reinforcers, that evoke and maintain problem behavior. Once we can show experimental control by turning off maladaptive behavior with the presentation of combined reinforcers, and turn it on with the presentation of evocative events or the removal of those reinforcers, then we've done our job in the FBA process and can begin treatment. According to this approach, the proof is in the pudding. Once you know the reinforcers that are controlling the behavior, you can start treating accordingly. If your treatment is effective, then you've done your job. And there are actually hundreds of research studies to support its effectiveness. According to Dr. Hanley, peer-reviewed research has shown that IISCAs are quick, safe, and reliable, and it is a means to understand enough about why problem behavior is occurring to design individualized treatments capable of eliminating problem behavior while promoting essential skills such as functional communication, delay and denial toleration, and contextually appropriate behaviors.
But with that said, you can look forward to future videos that more thoroughly review the research regarding this approach. For as mentioned earlier in the discussion of the Fisher article, those authors, along with many other researchers, caution practitioners who wish to incorporate the IISCA into their clinical practice due to its simplicity and efficiency, and recommend that researchers collect additional data on the levels and types of convergence and divergence between the IISCA and the traditional FA with more participants before drawing firm conclusions regarding the validity of the IISCA. And in the meantime, I highly encourage you to visit www.practicalfunctionalassessment.com